Hi everyone, welcome back to the Dr. Sia channel. In this video here today, which is part of a series of 10 common mistakes that ISTDP practitioners make, this video is going to be about overlooking projection. Let's get started. All right, sorry, what happened to my exposure? All right, so in this video, we're going to be talking about overlooking projection. Now, I just want to clarify what I mean by that, by overlooking projection. So as an ISTDP practitioner, you might have identified that projection is happening, and hopefully, if you're very highly trained, you might be able to sort of identify that projection is happening quite very soon in therapy. I mean within a couple of first, say 5 minutes or so in therapy, you should kind of be able to notice that something's going on if projection is kind of active. Now, what I mean by overlooking projection is not just kind of just talking about it and saying, oh, you know, this seems like you're sort of projecting. Do you notice that? Stop that. Which is kind of some of the most common mistakes that I used to make myself. I don't know if you're kind of finding that you're doing that too. You're kind of going, oh, you're projecting. Is there anything about me? If there's nothing about me, then you should kind of start projecting. Am I doing anything? No, I'm not doing anything. So why, so stop projecting then. And then the patient kind of goes, oh, okay, now I trust you forever. And look, yeah, sometimes that happens. Sometimes it's like that. Sometimes you kind of just need to talk about it and the patient kind of just looks at it very briefly or mention it, and they kind of just look at it and go, okay, well, I'll kind of stop that. But look, that's very rare. In most cases, projection is going to be there and it's going to stay there, and it's going to stay there for a long time. Now, what you could do is you could kind of go, oh, well, this is a boring topic by now. I should kind of move beyond it. But really and honestly, if projection is active, that's what you need to be talking about. And you need to be talking about projection for as long as you need to be talking about projection. What I mean is, therapy cannot be happening effectively if your patient cannot trust you. If your patient thinks that you are trying to hurt them, harm them, in any way bring about any criticism or judgment towards them, therapy is not going to be effective. So there's this kind of term that I call superseding defenses. You as a therapist, you know what it's like. You get in there and you don't just see one defense. You kind of see 10 defenses happening at the same time. And it's like, well, they're intellectualizing, they're rationalizing, they're diversifying, they're externalizing, they're projecting. Like, which one do I get to first? And more often than not, I would say, if you see projection is going to be the superseding defense. So then it really becomes a conversation around, well, if you can't kind of just davenlu it and just say, you're projecting, stop that, it's bad for you, you're going to kind of suffer for the rest of your life if you're projecting, stop it. If you can't kind of go at it that way, what do you do? What do you do to talk about projection? Like, it took me so long to kind of have a vocabulary, to have a language around projection, to have a language that allows me to not overlook projection, like actually talk about it with the patient, bring about a useful discussion, a healthy discussion with the patient about projection. So what does that look like? And here are some tips I have for discussing projection in depth with the patient without kind of just overlooking it or mentioning it and then kind of going, all right, well, that's the end of that. Now let's move on because it just kind of seems like we're not getting anywhere, or, I'm sure that you kind of let it go. 5 kind of things to do. One of the things to do is don't like kind of simply rely on unconscious signals. This is a very strong and powerful tool of ISTDP, to kind of rely on unconscious signals to determine our pathway forward. I mean, Davenlu was a genius. He discovered something really genius, but we can't just rely on striated size as such an ambiguous, kind of difficult to detect kind of thing, as just striated size an indication that, yeah, projection must be gone now. If a person is telling you, I still think that you're going to criticize me, I still think that you're going to judge me, but then kind of sigh after that, and you follow the sigh, more often than not, you've done something wrong. More often than not, you identified just maybe a conscious sigh as an unconscious sigh. So what you can do as the kind of number one thing to do, stay with the language around the projections. Here's some things that you have to ask. Do you think that projection is useful for you somehow? Do you think it's protecting you somehow? Do you think it's doing something for you here with me somehow? So we're checking whether the person actually believes that there are some benefits surrounding that projection. We're checking, in other words, for something called syntonicity. If you're working on projection, you have to check for the syntonicity of that projection. Not just for whether this person believes that, whether the person is delusional or not. So that question around, am I doing anything? Is there any evidence that I'm doing anything that's kind of, that shows you that I want to harm you or hurt you? It's kind of looking to see if the person is delusional, if they're kind of, if they have easy stereotypes, if they have kind of racisms, other isms, other kind of surface level traumas, that then they're just transference onto you. But you can do a lot more than that. You also need to look for the syntonicity of it. And you need to look for the syntonicity of it by kind of asking them, do you think, okay, so is there anything about me? No, there's nothing about you. Is there anything I'm doing? Is there any evidence at all? No, there's no evidence at all. So this is all in your mind. Yes, this is all in my mind. All right. Now, a lot of people kind of assume that that's the end of that, but it's not the end of that. Then you kind of ask, all right, so if it's all in your mind, what is it doing for you? Now, this is something that a lot of other videos don't really talk about. I've seen the John Fredrickson videos, for example, and he's a phenomenal therapist, but the YouTube videos that he has, and I'm sure that as a trainer, he exceeds well beyond the kind of a 3-minute YouTube video, but it kind of doesn't take you further in saying, well, then what do you do? And I'm sure that that's part of the training, but this is kind of one of the things that you do. So if it's all in your mind, if the projection is all in your mind, what do you think it does for you? What are the benefits of that projection? What are the good things of that projection? What are the meanings of that projection? You have to explore projection with a person that is not letting go of projection. So this is something that a lot of people sort of don't do, and a lot of practitioners don't do. They don't look to see, well, what does the person think they're getting out of that projection? Because the patient might say, well, when I project that you are going to criticize me. And then that allows me to sit back, to withdraw, because then you won't criticize me. Well, that's phenomenal. Now we kind of know why they are projecting. So then we need to kind of look, well, does it happen with everybody? Help them explore their projection. If they're not just letting go of their projection, you need to help your patient explore their projection. So does that just happen with me? Does it happen with everybody? Does it happen with children? What about women? What about men? What about older people? What about people of different color? What about people of different religious beliefs? What about people of different nationalities? Help them see their projection. Help them understand the complete picture of their projection. If it's syntonic, the person believes that the projection is doing something for them. And you need to help them explore that defense in its full extent. So one is to look for the benefits of the projection. Another one is to look for what that projection, how it kind of moves and shifts and how it changes between context. You can help them look for the frequency of their projection. Does it happen more often when you're in certain moods? Does it happen less often when you're in certain moods? That's about trying to help them connect it to their internal state so that you can help them see that it doesn't just shift according to what happens around them, but it might also change according to what happens inside, that they're more likely to project when they have certain internal states than when they have other internal states. For example, they're more likely to project when they're anxious and less likely to project when they're not anxious. So be looking for things like, what are the benefits of the projection? What are, who are the targets of the projection? Kind of where does it happen? Where does it not? The frequency of the projection. Also helping them look for things like the duration of the projection. How long does it last? And in doing that, and what the important part about that is for them to see potentially the costs, that if you've helped them see that the projection is really hurtful, if you've kind of gotten to that place by now, that they're starting to kind of see that, yeah, the projection is kind of hurtful, it helps them see that how long it lasts, how long it sort of takes over their lives for, how much of their lives it consumes, this projection. It can really help them get towards the grieving process when you pair that with the benefits bit of the projections. And it can also help them see, in a way, that it is not helpful, because if they're kind of projecting 80% of the time and they're still kind of really getting hurt most of the time, it can also kind of help them see that you know, I suppose the illogical nature of that, or that it doesn't actually work the way that they believe that it works. That if they believe that projection will protect them, and if they're hurt a lot of the time, even though they're kind of projecting 80% of the time, it'll help them see that, well, maybe this wasn't such a helpful mechanism at all. And I think the fifth and final kind of thing to talk about projection is not just assuming that there is one type of projection active. Often I've seen kind of my students say, yeah, but their projection was about them thinking that I'm going to criticize them. And so they kind of believed at the end, they said, well, I don't think you're going to criticize me anymore. And it's like, well, that's the end of that. Well, not really. You know, a person can have multiple projections. Maybe they don't think that you're going to criticize them anymore, but maybe now they're just going to kind of assume that you're going to dismiss them, that you're going to minimize or think that they're not really important, or that they don't really belong in therapy. So there are many different ways that projection can show itself, and we need to explore each and every way that could happen. I mean, for example, John Fredrickson released this iPod cast, where he was talking about how they were doing this treatment for a group of people who had substance use problems, and how one of the main treatment modalities was just working on projection with a huge number of groups of people, and how much they benefited from just learning about projection, working on projection, reducing their projections. And that's coming from one of the world's best therapists. So, you know, having talked about it for 11 minutes here, it's not enough, but there's so much more to say about projection. And if you are an ISTDP therapist and you are watching this video, please do send me videos with requests of common problems that you're coming across in your therapy, and I'm more than happy to talk about them if you think that my videos are useful and that you think that you could actually benefit from listening to my guidance, I suppose, on how you could get past those problems that you're finding in therapy. This series actually created as a request of an ISTDP practitioner who contacted me and said, Sia, I'm an ISTDP practitioner and I'm just starting out, and it would be really wonderful if you made a series for us people who are out there who are training ISTDP. So this is a video that came out of a request. I hope you enjoyed it. I hope you do put in your own requests. I hope you subscribe and press that bell button and comment, and let's get a discussion started. And if you haven't checked out other people who are on YouTube as well, if you haven't checked out Patricia Coughlin, she's out there too, actually making videos for her students, I suppose. It seems like it's very targeted for people who are kind of following her already. And if you're not, give that a go too. It'd be wonderful, and I think she's really useful, and I watch all her videos too. And once she was on one of my videos. So that's kind of special. Anyway, look, I hope you enjoyed the video, and I'll see you again for the next one. And the next topic is going to be assuming task agreement. I'll see you for that one.